Namaste and welcome to yet another interesting Facebook Live event. On the occasion of World Kidney Day, we'll be discussing a very important topic, which is our kidney health. And we're very honored to have with us Dr. Ranjanee Muthu, Consultant Nephrologist at Apollo Hospital's Greams Road, Chennai. Dr. Ranjanee brings with her a wealth of expertise and knowledge in this field, and she'll be here to address all your queries and questions. So, let's engage and understand a very important discussion today, which is on our kidney health. A very warm welcome, Doctor.
Thank you.
So, when we talk about kidney health, how important is the functioning of the kidney in the first place?
Kidneys are paired organs in our body situated in the lower back. They are just like a plumbers. So actually, which clean the drainage system of the body. So they're very, very important because as the drainage system remains clear, so it reflects on the functioning of the body well, breathable. There are no symptoms, there is no accumulation of waste in the body. There is no excessive fluid in the system. Salt and water balance is maintained. Blood pressure is maintained, and also synthetic functions of kidney like improving the anemia levels by producing the erythropoietin, and also bone health by activation of vitamin D is also happening. So overall health of the kidney depends on how the drainage system of our body is being cleared by it.
So, when you explained about kidney health and what is the functioning of the kidneys, what could go wrong with the functioning of the kidneys, doctor?
Normally, signs and symptoms don't come very early. Very few occasions only there can be early symptoms in the form of increase in the urination, especially in the night, and patients can have vague symptoms like easy fatigability, and blood pressure can be a little bit on the higher side. But as things progress and patient end up in advanced renal failure stages, the symptoms do mainly come to the fore in the form of patient becomes breathless because of decreased formation of urine. There could be swelling in the limbs, especially around the eyelids and in the limbs. They can have shortness of breath. They can have intense itching and darkening of the skin because of the waste products not being excreted. They get accumulated in the skin. They can have bad odor, and they can have sometimes loss of consciousness because of the products which can cross over into the brain and cause fits. So these are some of the symptoms and signs which the patient can present with, and also they can have increase in the blood pressure, which can go haywire and then can cause havoc in any format. It can take the form of stroke also.
And what are the important roles of be it diet or be it being hydrated enough, which plays a very crucial role in kidney health? Are there any specific foods or nutrients, or can you also explain the importance of being hydrated, doctor?
As we already mentioned that kidneys are plumbers and they play a very important role in maintenance of water and salt. It's very, very important to keep ourselves hydrated because it's a natural flushing process. So adequate fluid intake is very, very vital. So based on the body weight, roughly we can say that if the body weight is around 100, divided by 30, so around 3 liters to 3.5 liters of fluid is adequate for individuals who's around 90 to 100 kgs. So this is based on that is total body water is around 65% in females and around 70% in males. So based on that, we have come to this rough calculation of around weight divided by 30 equal to the number of liters a person should consume water. Also, I don't advocate that one person should take excessively more water, which is actually not advised because they can have increased fluid accumulation and it can cause bloating. So unnecessary water intake is also not advantageous, especially in elderly individuals because they are not able to conserve water well. And when the possible that they take more liquid, the other ions in the body can appear as low. Their elders are more prone for hyponatremia, which is also because of increased fluid in the body.
Which means it can get depleted as well.
Correct.
So, and how important is diet?
The diet part is very, very important because one has to concentrate because what you eat is going to get converted or it's going to get metabolized and broken down into protein products, which are especially solely excreted only by kidneys. So we have to be very careful about what protein diet we take. Increased protein can cause increased urea production and subsequently can lead to increased protein load to the kidney, and kidneys have to work more to excrete them. So as compared to animal protein, plant protein are supposed to be much more safer. They reduce the load of the kidney. Always look for a balanced diet. Anything is in moderation is good. Anything excessive can cause injury to the kidney. Cut down on the salt intake, and also it's very important because it can be a proponent of high blood pressure. Cut down on your alcohol intake. quit smoking today. In any form of smoking is going to be injurious not only to the lung function but also to the kidney function, because it can potentiate hypertension, it can lead to kidney cancer, etc. So it's very important to look on those aspects of diet also.
Which was precisely my next question to you, as to how much salt is optimal for consumption for a
Normal Indian diet normally advocates around 5 to 6 grams of salt. But in case if you have a kidney disease, normally doctors advise you on taking less salt, around 2 to 3 grams, depending on your cardiac health and kidney health. And normally I would want to say about some different types of salts which are now available in the market. Especially they are the black salt, Himalayan salt, pink salt. They are all actually very rich in potassium but low in sodium. So actually they are very advantageous for people who have only blood pressure and don't have kidney issues. But once the kidney issue sets in and the body tries to accumulate lot of potassium, they are not able to excrete that out. So such type of salts are not advisable for people who are kidney patients, and they again have to revert to a normal salt which is available in the market, but we have to take in a less quantity. Also, I want to reiterate, please cut down on your processed items which are freely available in the market. Always look for the labels of salt when you go for purchase of items. Process contains hidden salts. Avoid papad, achar, and tinned items which has got lot of salt hidden in it.
frozen items as well.
Yes.
Doctor, can you discuss and let us know about the link between kidney health and other conditions such as diabetes, hypertension, or even cardiac issues for that matter?
Yes, actually, it's a very important question. Thanks for that. And actually, they are definitely interlinked. Actually, for example, like uncontrolled sugars and with duration of diabetes, they are more prone for protein leakage in the urine and subsequently can lead on to kidney injury. Similarly, blood pressure can narrow the blood vessels and also the vessels which go to the kidney, and subsequently decrease blood flow to the kidney happens, and it can cause the ischemic shrinkage of the kidneys, and they proceed for chronic kidney disease. And heart, obviously, because it's an important vital organ which pumps out the blood to the whole body, and kidneys are an important organ which receives around 25% of cardiac output. So in case if the heart patient is not able to pump out effectively, obviously the blood flow to the kidney is going to be compromised, and then they also can have blood pressure. So both these components can adversely affect the function of the kidney. So all three are all these diseases are all interlinked, and they have to be taken care of well in advance, and screening of at-risk individuals is very vital.
Doctor, speaking of people with comorbid conditions, how do medications and supplements impact the kidney function? And what should these people who are already comorbid should be aware of before or while taking them?
Medications and supplements are an important arena in anybody's health profile. So one should be very careful that what they are consuming. Knowing their kidney health beforehand is very important, because it will allay and it will delay the complications associated with any inadvertent usage of drugs, like any cardiac drugs or any diabetic drugs can be useful for diabetes, but when it is given in a patient who is also having kidney issues, can have complications because of its being metabolized by the kidney and kidney functioning worsening. It is possible that that dose may not be adequate. So it is important to know about several drugs, especially painkillers should not be taken for a kidney individuals, and always look for alternatives in the form of gels or other safer alternatives should always be looked upon when we deal with medications. And always, if you have a medication which is normally not excreted by kidney, or the excretion mode is via the gut, or it is via the liver, it can also help in protecting the kidneys to some extent. Coming to supplements, normally there are a lot of supplements and myth, and a lot of information is available in the net. So we have to caution the individuals about them is especially don't go for any gymming product which contains a lot of protein product just like that without the advice of a doctor. If you are hale and healthy, to some extent the kidney will be able to excrete them. The high protein diet can cause transient rise in creatine, which is the marker of kidney function, and transiently there can be increase in the protein in the urine, which can become normal. But if the kidneys are not functioning well, they are going to cause havoc, and they can end up in having permanent kidney damage. Also, many heavy metals hidden in native preparations, and especially the Siddha ones and the homeopathic medications are all rich in hidden heavy metals like mercury, lead, they are all can slowly get accumulated in the kidney and can cause kidney damage. Also, I would reiterate the use of whitening creams. They are rich in mercury. They can cause kidney injury when accumulated and when used for a longer period of time. So always you go for good brands. Always read the labels beforehand before you consume or use products like this, and keep your kidneys healthy.
Even when they are externally applied, doctor?
Yes, because low consumption of mercury and heavy metals through any means can get absorbed and can reach kidney via the blood system and can cause kidney injury and can cause permanent kidney damage.
Doctor, you see a lot of patients every day, and you may come across them sharing some misconceptions that they have heard, they follow around kidney health.
Okay.
Can you address a few of them, please?
Most of the time it's about the water. So they always feel that if they have kidney disease, they are not supposed to take large quantities of water, and they themselves start restricting them. Actually, this is not true. Not all the kidney disease behave similarly, and there are some conditions where that kidney may start losing fluids and ions from the system, and sometimes we have to advocate more fluid intake and salt intake to such individuals. So always it should be a customized treatment for patients, and patients should take advice mainly from the doctor only and not by hearsay or from relatives on this aspect. Similarly, information on salt, which I want to just reiterate, that always look for the labels, and also see to it that salt with low sodium containing preparations are good if you have only hypertension and not any kidney issues. But when you start having kidney issues, also see to it that your form of salt is going to be normal iodized salt and not any special salts like black salt or Himalayan salt. Also, I want to reiterate about the myth which is normally there, that is why I should donate kidney, and kidney donation is not safe and I may become ill. So this is also a myth, I think. So donor is very, very important. So only after full investigation he or she is being taken care for donation. So even some patients are born with only one kidney. So it is definitely a myth that kidney donation is going to be harmful. So at the time of donation, we ensure that kidneys are functioning well, and only thing they need to just take some small precautions in the form of some dietary precautions, and they have to avoid some over the counter prescriptions, painkillers, if they have already become donor. So kidney donation is perfectly safe if you have good healthy pair of kidneys.
Speaking of the next most important and most prevalent term that surrounds kidney health, creatinine levels. Can you tell us what is an ideal creatinine level? And can you also indicate and tell us why there are elevated creatinine levels and why is it harmful?
Actually, creatine is a marker of kidney function, and we don't have better marker than that as of now. It's a marker for glomerular filtration rate. So actually, it's a product. It's a end product of protein metabolism, especially the muscle protein, which gets broken down and gets converted to creatinine, and it's being excreted by the kidneys efficiently. But when the person is not able to eliminate them effectively because of by virtue of kidney function, the creatine can creep up, or any increased protein intake can cause not only the creatine but also the urea. So it's a proportion of urea and creatine which actually will tell whether the patient is having only kidney disease, or there could be other condition associated, or could be a pre-renal conditions where only because of some other conditions like starvation, dehydration, or increased protein intake transiently have caused the issue, or it's a real kidney function which has been affected, causing the creatinine to go up.
Doctor,
The normal range actually varies from zero point 0.7 to 1.0, depend upon on the muscle mass. It also varies with race, age, and sex. So actually, it's not. It sometimes overestimates the glomerular filtration rate, but as of now, it's one of the simplest tests which is being offered, and also it is being considered because creatinine is being filtered at a very constant rate by the kidneys, and also its concentration is same as in the plasma. So it is being considered as a good functioning marker of kidney.
Doctor, moving on to another major or very prevalent condition, which is the kidney stones. Can you tell us what is the major cause of kidney stones and how can we tackle them?
Kidney stones are by and large mainly because of sedentary habits, overweight, diabetes, and very, very rarely it can be associated with genetic issues. They can be multiple, they can be single, they can be on one side or they can be on other side, or they can be at any form of anywhere in the tract, starting from the kidneys to the ureter to the bladder, up till it comes out. So it is important to know about them, as we can prevent kidney formation by, I think, concentrating on fluid intake, cut down on your animal protein, especially red meat, and take more of plant products. Cut down on the purine rich diet, mainly the poultry items or the seafoods, fizzy drinks to be avoided. Smoothies like spinach smoothies, which are very rich in oxalates, have to be avoided. And berries also, to a great extent, should be avoided, especially for oxalate stones. On the contrary, vitamin C, which can be given to remove uric acid stones, are found to be beneficial. And also reduce your salt intake, which can also help in protecting the kidneys and preventing the formation of stones. Cut down on the weight also, do exercise and avoid sedentary lifestyle, take adequate amount of fluid intake.
Doctor, speaking of treatment and kidney diseases, what are the advancements or emerging therapies today in nephrology as a department as a whole that offers hope to people suffering from kidney diseases?
Actually, in all the aspects of nephrology, there has been advancement, starting from diagnosis. Also, we have now coming up with functional MRIs and with novel techniques to detect overall remaining functioning nephrons, and how much is a permanent damage which has happened. All those things can be found out. We have got some novel molecular markers available now to detect kidney functions effectively, whether they are acute or chronic. Also, in the terms of, we are looking forward to a targeted therapy, so we have got innovation in the form of newer medicines also available to target specific therapy, especially in the field of diabetes. We have drugs like SGLT2 inhibitors, we have got findrinone, which have got really advancement. It protects not only the kidney health, also has got an important role in reducing the hospitalization rate, especially in the heart failure patients. And coming on to the specific treatment in the form of renal replacement therapy in the field of dialysis, we are now coming up with online HDF mode, where we are able to improve the quality of life by effectively not removing not only the small molecules, but also the larger molecules are being removed, and the complications of dialysis are being taken care of. We also have something called as wearable kidneys, where the patients can do their work simultaneously, and the device can effectively remove the waste product. And we have something called as bioartificial kidneys, which can actually work like kidneys. Coming to the transplant, we have got work on stem cell therapies on the way, and we have bioartificial kidneys, where there is a bioreactor with renal epithelial cells in it, and there is a membrane filter which can almost function like kidney. So in all the aspects of nephrology, we are now coming up with innovations, and the day is not far when we'll be able to live without dialysis and transplant.
Doctor, can you also let us know the importance of early detection and the management of kidney diseases when it comes to improving outcomes? What is the importance of early detection today?
Actually, timeline in the kidney is very important, because most of there are only three spectrums. Like, we have acute kidney injury, which normally presents as hours to days, and sometimes need dialysis need. And also, we have something called as rapidly progressing renal failure, which occurs around weeks to months, and that should be treated within 3 months. And we have the last entity, which is called as chronic kidney disease. If the damage is there for more than 3 months, it becomes irreversible. So most of the patients who are falling into this category, they don't have any major symptoms initially. So it's very important and imperative to diagnose and pick up very early. And also, there's a role of screening, especially the high risk individuals like diabetes, hypertension, cardiac individuals. They all have to be subjected to increased early screening. If you have a family history, it's again important to go for annual health checks, be proactive about it, and pick up, because we have only few markers with which we can diagnose the kidney function, in the form of only function tests in the form of 1 and creatinine, and we have urine examination. So all the kidney diseases normally present in only these way, and there are very common symptoms and the common signs in the form of this abnormal test. So it's very important to pick them early, so that the complications can be prevented, they can be followed up for a long time, so that some aspects of disease can be modifiable, it can be reversible also. Like for example, if you have microalbuminuria where only a small quantity of protein is leaking in the urine in a diabetic individuals, if you tackle them early with ACE inhibitors or ARB, it is possible that it can be reversed and kept at bay, and the complications of kidney disease can be allayed, can be postponed, if not totally prevented. So it's very important to know that chronic kidney disease is irreversible. So we can cut down the rate of progression of kidney disease by intervening by any therapy or by any medication, but it cannot be totally curable. So it's very, very important to pick them early so that the complications not only involving the kidney but other organs like eyes, heart, stroke, all those things can be prevented. And it also says that utilization of better resources can be there if you plan early. It also reduces the financial burden, because when the complications occur you have to get admitted. So it's always important that also based on the socio-economic strata of India, it's important to screen the at-risk individuals early, screen them, treat them effectively so that complications can be postponed.
Doctor, how do you approach kidney health in older adults, given that they have age-related changes, potential complications that may arise as they age? How do you treat elderly people, doctor?
Elderly people are a very important special group. I think they should be considered at-risk population. So already they will have all the important effects, long-term duration effects of diabetes, hypertension, or any cardiac ailment in them. So they are more prone for complications. So especially when you see the hypertension part, they have to be dealt very carefully. That we have to be little liberal in treating them. The targets may not be very tight for such individuals, and they have to be also cautioned that they have to not get up very suddenly when they have pressure, because they are more prone for hypertension also. So their sugar and blood pressure levels have to be little liberal. They cannot have tight controls. Also with age, I think the kidney numbers, the functioning units of the kidney, which are called as nephrons, they go less in number. So actually the creatinine levels actually are little lower. So at the rate at which they go for dialysis or transplant is not at the same level at which the other normal adult.
And
Say
what
like,
age is this
so
that
like
you're
around
talking
more
about?
than 65 is being considered as elderly. So even a creatinine of around 4 to 5 in a individual who is elderly can present as a CKD stage 5, and they can have the need for dialysis. So creatinine levels also modify according to the age.
We'll take a couple of questions from our viewers, doctor. My father has always struggled with blood pressure for years and recently learned that it could affect his kidney function as well. How can I manage his blood pressure to protect the kidneys?
It's a very good question. Thanks for that again. Individuals who are having blood pressure or which are uncontrolled, we have to first find out that they have been having uncontrolled sugar for a long time to begin with, or they have been having a good control and now recently only has gone up for high blood pressure levels, because it has got different implications. So if it's a recent rise, we know that it could be a treatable cause. It could be a heart failure which could have triggered, or because of decreased compliance and not taking the drugs, or it could be because of a new onset acute kidney injury which is taking a toll. So it's very, very important to know that at what point of the time the blood pressures are going high, whether it's throughout the day or it's during the daytime or during the night time. Especially in kidney individuals, the night BP will not be controlled. There is a normal nocturnal dip actually which happens in normal individuals, which is normally absent in kidney patients. So that has to be also taken into account. So there is an important role of ambulatory blood pressure monitoring device, where I think a device is being kept in which is like a belt actually, which is being placed, and the BP cuff is being placed in the hand, and it monitors the blood pressure every 30 minutes. That is being kept for 24 hours, and the next day it is being recorded. So with that, the doctor can see that fluctuations happen in which part of
Part
the
of the
day,
day.
and accordingly the medications can be given at that point of time where there is a surge. So it's very important to use multiple drugs. Fixed drug combinations is very important, and always talk to the patient about the need of multiple drugs, and ensure compliance, and tell them the benefit of it. And it also will help them not only to prevent kidney health, to protect the kidneys, but also allay other complications related to high blood pressure, mainly the eye and cardiac disease and stroke can be prevented.
I've noticed that my uric acid levels have been elevated during my recent blood tests. What are the potential implications of this, and how can I manage my uric acid levels naturally? Doctor, firstly, is there any connection between uric acid level and kidney health?
That's very interesting questions. Actually, uric acid is again a protein enteric. So, in individuals like birds who have this enzyme which is called as uricase, they are able to excrete the uric acid in the form of allantoin. But this enzyme is not available in male in humans. So, we have something where the nitrogenous products, which is generated out of breakdown of protein, get converted into urea in the liver by the urea cycle, and then it is transported to the kidneys for excretion in the form of urea. So uric acid is, it's only less than 1% of nitrogenous waste which gets excreted in the form of uric acid, and most of it is absorbed by the body. So whenever the uric acid is elevated, it could be because of increased production because of any means, or it could be because of decreased elimination. It's mainly the decreased elimination which is normally being considered and is very harmful and hint towards the kidney disease. It not only act as a potentiator, it could be an initiator of the kidney disease. It is associated with other conditions like diabetes, obesity, hypertension. It's a part of metabolic syndrome. So it's a conglomeration of symptoms which lead on to condition which is called as metabolic syndrome. So just merely having a high uric acid does not mean the patient is having kidney disease. There could be these factors which could be contributed to uric acid levels. But if in case uric acid is on the higher level and the patient is, if it's also associated with increase in the BUN and creatinine level, that could give a hint that patient is actually having a kidney disease, and that needs a good control of uric acid levels. Normally it's to be kept below 6 in kidney individuals. But there is a little bit controversy. Not many people advocate that, and not everybody tends to treat uric acid levels because there is not a strong evidence as of now, but it is suggested that it is helpful to treat uric acid levels and keep it below 6, especially in kidney disease patients.
Hello, doctor. I was diagnosed with kidney stones, but I'm worried about the long term effects of surgery, which I was advised. Is there a non surgical method to get rid of kidney stones completely?
Actually, whether to go ahead for surgery or non-surgery depends on the site obstruction and site of stone available in the tract. So if it's in the kidney and the size is around less than 5 millimeter, it's possible that via natural process and with good hydration and drugs to relieve the pain and to flush it out, it is possible that we can get rid of the stone. But if it's larger in size, it's also in the tract, especially in the ureter, and it is blocking multiple numbers, it's possible that we need to go for intervention. So there are minimally invasive interventions possible. One such is actually extra shockwave lithotripsy, where external shockwave is being provided to the site where the kidney is exactly there, and it's ultrasound guided, and then it is being powdered. It's almost broken down into powdered form, and after which the stones easily come out. Sometimes it is possible that the full powder form is not possible, and then small granules still remain, and to prevent the obstruction, normally we do a cystoscopy and place a stent over there so that the blockage of the tract does not occur, and efficiently the stone comes out and clearly comes out. So ESWL is a one good form of non-invasive therapy which can be tried in individuals who have a good sizable stone which is not coming out. Chances of it coming out naturally is going to be less, and it is quite effective.
Today being World Kidney Day, doctor, what would be your message to our viewers?
I would like to say this year theme is actually provide equitable health for all. So ensure that you are proactive, do your annual health checks regularly, and don't ignore your symptoms. Be a organ donor today. Thank you.
Thank you very much, doctor. That was a very interesting session on all we needed to know about kidney health, especially commemorating World Kidney Day today. For appointments with Dr. Ranjanee Muthu, Consultant Nephrologist, Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. I repeat, for appointments with Dr. Ranjanee Muthu, Consultant Nephrologist at Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. Thank you very much, doctor. Thank you, viewers.
Thank you.